Good morning, good afternoon, good evening, and welcome to this Together to End Violence affiliate event, Are Schools Safe to Learn? It is great to see so many of you today connected from so many countries around the world for such an important topic for children, for adults, and humanity. Today's event will last 1 hour and will be recorded. It is now my great pleasure to introduce you to the moderator of today's event, Dr. Chloe Fevre, the Director of Safe to Learn Initiative.
Thank you very much, Catherine. And big congratulations to Catherine Flagotier, who is a Senior Safe and Inclusive School Specialist at the Safe to Learn Secretariat for leading the organization of this event. It's my great pleasure to welcome you all today to this global event to actually showcase the experience at country level of what it means to assess progress towards making schools safe. So today the focus is on action. It's on how to. It's on countries and how we all as Safe to Learn partners can support countries in accelerating progress towards ensuring that all girls and boys are indeed safe to learn. This is why the Safe to Learn initiative was created in the first place, to accelerate progress in embedding violence prevention in education systems and making learning and safety inseparable. As many of you know, the Safe to Learn initiative is actually a coalition of 14 global partners from education and child protection fields coming together to really build and strengthen an ecosystem for supporting actions towards safe learning. Today, you will hear from several of Safe to Learn partners, including UNICEF and UNESCO. So the Safe to Learn Diagnostic Tool was one of the first activities undertaken by the coalition. The coalition was born as a result of a youth manifesto that was done at the end of 2018. And really young people from all over the world calling for prioritizing safe learning environments everywhere. So these 14 global partners came together. And one of the first activities was actually to develop these Safe to Learn diagnostic tool that we will discuss and we will present today. It's, what is unique about this tool is actually it's a joint tool. And that's really the key word here. It's a result of a meaningful and expert-led collaborations between all Safe to Learn partners, even though UNICEF took the lead in really building and taking all the inputs and the contribution from all partners, in particular UNESCO, the World Bank, and UNGAI. So this is a tool, we wanted to have a joint tool so that it would be easier to speak with one voice and have a common assessment, both with our partners in countries, with our partner governments, but also us supporting progress at the country level so that we can be together more impactful and consistent over time. In the end, we began with a diagnostic mainly because we all want results and we want results fast. But to get from setting a priority to delivering impactful and lasting actions, we first need to have a solid diagnostic. Everybody would agree with that. And so this is what we will be talking about today. The Safe to Learn diagnostic tool goes hand in hand with the framework and the benchmarking tool that together provide operational guidelines to really help countries implement the Safe to Learn call to action. So far, we have 15 countries that have endorsed the call to action to give higher priority to ensuring safe learning for all in the education system worldwide. And we invite all countries to sign the call to action. So we will begin with an overview of the tool itself, but we will also focus on learning from 3 experiences in 3 countries that really led by examples and implemented the diagnostic tool and adapted it to their own context to identify priorities for action. These countries are Jordan, Uganda, and South Sudan. As you've probably seen in the agenda, we wanted to begin the event with a testimony from a charismatic leader in the field, Dr. John Wende, but unfortunately, Dr. Wende had an unexpected event that happened just a few minutes ago and is unable to join us today, but she has kindly agreed to record her testimony because she's really a powerful and charismatic leader in the field, in particular in Kenya, to share with all of you. So we will be sending that following this event as a link with all the documentation that we talk about today. So first, let's talk about what the Safe to Learn diagnostic tool is about. The main author of the tool is actually one of the best experts on child protection worldwide. His name is Mr. Stephen Blight, who is Senior Advisor in Child Protection at UNICEF headquarters, and who really has pulled together all the contribution from the Safe to Learn partners and the best practices in the field to come up with this joint Safe to Learn diagnostic tool. So Stephen, without further ado, the floor is yours. Thank you.
Yeah, thanks, Chloe. Thanks for the great introduction and the great explanation on the background of the Safe to Learn initiative. Next slide, please. Okay, what's at the core of this initiative is the call to action. This call to action sets out the programmatic and advocacy objectives of Safe to Learn. And by endorsing this call to action, ministries of education provide a high-level expression of their commitment to the Safe to Learn agenda and to the Safe to Learn call to action. The call to action is at the core of what we're trying to achieve through this initiative. Next slide, please. But how can we hold ministries of education to account for this commitment? What specific measures do we want to see in place, not only at national policy level, but also very visibly embedded at school level? How can partners on the ground build capacity to support implementation of these measures? And how can we measure progress, both in filling gaps at country level and in measuring global progress of the initiative as a whole? Next slide, please. So we've been working with Safe to Learn partners to put together a technical package. Now, the starting point is the call to action, the frame of reference for all of us working on Safe to Learn. And the call to action is translated into a series of benchmarks. And by benchmark, we mean a standard or a point of reference against which things can be compared or assessed. So these benchmarks set out the accountabilities of the education sector in prevention and response to violence against children. They're drawn from a wide range of UN standards, guidance, and manuals from UNESCO, UNGAI, WHO, amongst others. Now, what about the diagnostic tool? We designed this tool to inform collective dialogue between the Safe to Learn partners and national education counterparts. Based upon the benchmarks, the tool sets out a series of checkpoints at national, district, and school level in order to assess to what extent the education sector is meeting its accountabilities to protect children from violence. It assesses to what degree education sector policies, systems, and programs to end violence are actually implemented on the ground. And it can be used to establish a baseline, to agree on priority actions, and to learn from good practice at national, district, and school level. The final technical piece is the programmatic framework. This is a guide for in-country partners to support building the capacity of the education sector to meet its accountabilities. It aims to translate the call to action into practical interventions, highlight technical resources to assist in the design of interventions, and set out a framework for the measurement of results. Next slide, please. So this schema sets out, in essence, the design of the diagnostic tool. You'll note on the left, the call to action is broken down into a series of about 15 benchmarks. And for each benchmark, there are national, subnational or district, and school level checkpoints. These checkpoints are objectively verifiable indicators to assess whether the benchmark is achieved or not at the different levels. Next slide, please. And this slide provides an example of how a benchmark is broken down to checkpoints at the various levels. For example, you'll see it shows as a benchmark, every country should have a national policy framework and a national child protection or safeguarding policy to address violence in schools. But in addition, there should be evidence of implementation of these policies at subnational and school level. Next slide, please. So with support from FCDO, the World Bank, and UNICEF country offices, the diagnostic tool was implemented in 5 countries between late 2019 and early 2021. The selection of the countries was based upon a strong interest of in-country partners to scale up efforts to end violence in and around schools, and to use the diagnostic tool to set a baseline. Now, the exercise was designed to be quick, but there were significant delays due to COVID-19, not only because of the inaccessibility of schools, just as the exercise was getting underway in some countries, but as well due to the overall disruption of the education sector linked to the pandemic. Next slide, please. So these are the steps that were undertaken in implementing the tool. As a first step, we implemented the exercise where Ministry of Education could assume the leadership. This was necessary to ensure its success and its influence on national education policies and systems. In countries where there was a highly decentralized education system, this was an additional challenge because we also needed to get the agreement from each of the provincial education authorities. In each country, the research was carried out by national researchers who interacted with global technical assistance provided through Cambridge Education to develop the methodology and ensure it was locally contextualized. The development of a sample frame of districts and schools was a key component. Keep in mind that this is a rapid assessment methodology. It's not intended to come up with a nationally representative statistic. Rather, it's a quick and cost-effective way to assess whether there's evidence of policy implementation at district and school level. So the number of schools sampled varied from 22 in South Sudan to 80 in Pakistan. And within each district, there was a random selection of schools with attention to the balance of rural versus urban schools, public versus private schools, primary versus secondary schools, and in some cases, schools for boys and schools for girls. Phase 1 of the exercise comprised of a desk review of national policies and programs, and phase 2, fieldwork at district and school level. The results were presented at roundtable discussions. These were most successfully organized in countries with active local education groups that were multi-stakeholder and engaged in issues on violence against schools. And the dialogues allowed the countries to note progress, identify gaps, and agree on priorities in strengthening school-based violence prevention. Next slide, please. So as next steps, we're conscious that the education sector remains focused on safe school reopening in the context of the pandemic. We're therefore integrating basic violence prevention and response measures as identified through Safe to Learn as essential services within the framework for reopening schools. We're also making the diagnostic tools available for all countries and promoting their use. This includes access to the questionnaires and the methodology that could be adapted for use by other countries who want to try this out. As the gaps and priorities are identified through the use of the tool, we will be supporting programmatic responses to help countries meet all the benchmarking. Tracking the benchmarking analyses over time will allow us to measure progress at country level and across countries, measure the impact of Safe to Learn at global level. Next slide. So a big thank you for your attention. I look forward to hearing from some of the countries who have used the tool to hear their feedback. And back to you, Catherine. Chloe, sorry.
We'll take the floor. Thank you so much, Stephen. It's fantastic. And as you very eloquently and clearly explain, all the development of the tool and the different characteristics of it and how to implement it, I really loved, your conclusion in terms of the reopening of schools and the prioritization of, key measures to ensure violence prevention within the school reopening plans moving forward. In terms of the access to the tool and to the benchmark and the framework, also wanted to flag that we have translated them into French and into Spanish, so they can be accessible to different regions in different languages. And we will make all these documents widely available to all. So a big thank you again to Stephen for this fantastic presentation. So now let me turn to the country level and see how this tool actually has been useful for three key countries' leaders in terms of pioneering the implementation of this tool in their own context. So we have asked them to answer two questions to frame their presentations. And these questions are, what difference did it make for your countries to undertake the Safe to Learn diagnostic? And the second was, what are the next steps to ensure schools are safer for all children in your country? So following the speakers in these three countries, we will have some time for Q&A. So please, don't hesitate to put your questions in the chat. I think that the Q&A function is not working properly today, but please feel free to, put your questions in the chat and we will gather them for our speakers after the presentations. So our first speaker today, in terms of country engagement and leading by example, is one of our colleagues, Susan Kasht, who is child protection specialist at UNICEF Jordan, who has kindly agreed to work hand in hand with Mr. Hababe, who is the head of counseling sections at the Ministry of Education in Jordan. Unfortunately, Mr. Hababe was not able to join us today, but Susan has kindly agreed to do the presentation for both of them. So the floor is yours, Susan.
Thank you so much, Chloe, and thank you for all colleagues and for this chance. I would like to share my presentation. I hope it's clear now. Yeah.
Fantastic.
Okay, thank you. So I'm going to reflect a bit on our experience. As Stephen mentioned, there was some delays due to COVID, but happily and finally we were able to finalize it lately. So I'm going a little bit to go with a glance at some highlights on Jordan's situation. We can see from our data that there is decrease in violence against children. Still, it's really high from 2012 until 2017-18. Still, it's high. It's 81%. And also, we have 6 out of 10 children are experiencing physical violence. We have also 14 of the people interviewed with the DHS Demographic Health Survey believe that physical punishment is needed to raise a child. Where also we have the issue of acceptance of violence against women. We have 7 of out ever married women accept violence or violent behaviors from their husbands. In the same time, we have around 70,000 children engaged in child labor. We have 75% of the juvenile at first-time offenders, and also we have a high number of early marriage and child marriage, where we have 1 out of 3 girls married before the age of 18. I just wanted to highlight our main program with to end violence in schools with Ministry of Education. We call it MAN program. It means together towards a safe school environment. You can see that the data show us the decrease in violence, physical and verbal violence, emotional violence from teachers to students over these years. Still, we really need to work also close hand in hand with MOE to make sure that schools are safe for children. Our program focused on different areas. First of all, we had a school-based activities engaging children, community, and also educators in child protection activities. Also, we have raising knowledge and skills of teacher to deal with children in a positive way. We have also the evidence generation through our monthly online survey that children fill on a monthly basis. And also we have prevention programs like the Better Parenting program and the C4D programs like drama series and other community and bullying and violence programs in schools. Our study started with having adaptation for the tools, for the surveys. They were translated to Arabic and adapted to the context in Jordan. Also, due to COVID-19, we were not able to do face-to-face interviews. We went for virtual and phone interviews. And also there was a huge part of the study depending on the desk review of relevant documents related to violence in schools and child protection in general. We have selected 24 schools, boys and girls, from the 12 governorates in Jordan, including Syrian refugee camps. We also had a key informant interviews with the official stakeholders at national and directorate level. The key highlights that we took from this exercise, honestly, it was really interesting. The findings assured some issues that we already know, and also the study helped us in really identifying issues that we really need also to work on. For example, it showed that we have a strong evidence-based programs. In general, we have data, we have studies, but in place. In the same time, it showed us we have a higher political commitment, but Jordan is lacking an MOE, the resources and multi-sectoral action by the government. We have a very good, let's say, national frameworks, or standard operating procedures in place, and still we really need to make sure that everybody is following up these standard operating procedures and it's implemented in a quality way. MAN program and the effect of MAN program and the activities were highlighted as a good findings. Also the positive parenting program. We have also, the study showed us also a weak and limited institutional capacity, the budget allocation, and also the accountability. So also this gives an indication to work more on the social work and resources and services. Also, it showed us that we really need to work more on investing in really measuring the results of the behavior change programs that we have in place. I'm sure that for the different areas, we have different, let's say, best practices that they were highlighted. I'm not going to go through them all, not to take time, but for example, I'm going to highlight the existing of national framework and SOPs. Corporal punishment in Jordan within MOE was banned in 1981. We have a draft law that is ready now to be submitted to the Parliament to be approved and endorsed by the government. We have the Ma'al online survey. We are also launching a national VAC study in December now to highlight the percentages. And we have also social norms. We have a national plan endorsed by 7 ministries also to address social norms. So we have a quite of really best practices in place. The way forward with our Ending Violence in Schools and program and working with the Ministry of Education is really part of our chart program in general, linking it with case management, linking it with different sectors. So we're going ahead now in line with our strategic framework of violence, also on the global level, the main priorities, scaling up Ma'al program to reach all schools at different levels to ensure that we have taking the gender perspective into consideration, while boys in Jordan are experiencing more violence than girls. So we need also to focus with specific programs and approaches for children. We need also on the mental health and psychosocial support. We need also to make sure that we're building capacity within the government, NGOs, also for service delivery, focusing on case management and referrals, and the social work, and the work with on the counselor capacity within MOE as well. As being Jordan has being announced a pathfinding country recently, and part of that we're going to work on a national plan of action for ending violence against women and children. And this is a great opportunity for us also for Jordan commitment to scale up all the VAC efforts that we have in place now. We're working also on the multi-sectoral collaboration between different sectors. So violence against children should be addressed through different sectors. For example, as part of the case management, looking into, for example, how we can really refer to end child labor. Maybe also we strengthen the cash assistance for families, making income generation opportunities for the families, even for the child marriage, and also the bullying programs, linking also with the health sector to identify and refer the cases. So there's a lot of things that we're thinking to move ahead with. So this is all from our side. And thank you so much for the opportunity.
Thank you so much, Suzanne. This was a very compelling presentation, and clearly best practice from Jordan in terms of, building on the evidence and really trying to build on the interlinkages between different forms of violence anywhere they happen in the life of children. And what I really like about your presentation is also you were very clear in showing that the diagnostic is useful to showcase the progress, like, what is already doing and going well, and also where we need to put the priority, what is still missing. And that's really a prioritization tool in that sense. So one, thank you for the fantastic work that you're doing together with the government in Jordan, to make our children safe. Thank you. Our next speaker is from Uganda, and her name is Ms. Rosette Nyanzi. Ms. Rosette Nyanzi is the Gender and Equity Technical Advisor at the budgeting unit within the Ministry of Education and Sport in Uganda. And she has kindly agreed to be with us today to share with us all the experiences in Uganda, who is another leader in the field in terms of commitment towards safe learning environments. Over to you, Ms. Rosette. You're probably on mute still. If you can unmute yourself, please.
Yeah, thank you very much, moderator, for giving us the opportunity to share our experiences in implementing the Safe to Learn. Our study was done in 2019, and we got the results early in 2020 with very interesting, interesting issues coming up, but also being able to highlight the gaps that we had much as we've been implementing a number of programs on prevention of violence against children. So I'll go straight to what we have to share with you. I request that you move the slide. Yes, we all have very good policies as a country, as far as talking about issues of child protection. Our constitution is very clear. And in 2014, we had developed guidelines for reporting, tracking, and responding to violence against children. So the diagnostic study actually found out that this was a good step. However, this document that we had developed at that time was so bulky. And the recommendation that was we should make an abridged versions targeting the different stakeholders. And for us to make sure that we implemented the recommendations, as Ministry of Education, we have already developed the abridged versions where we are targeting learners, teachers, community, police, and health personnel as far as the reporting, prevention, response, and referring cases of violence against children. So for us, that was a good step as far as the diagnostic study was concerned. The other issue that came out was the multi-sectoral approach. Yes, we as a country, we had our sectoral engagement on issues of ensuring safety and security in our schools. And as Ministry of Education, we have an intersectoral committee on violence against children with members from Ministry of Health, Ministry of Gender, Labor and Social Development, from the judiciary. But what came out from the diagnostic study that we needed to strengthen that. And as a ministry, we've gone ahead to strengthen that. But we also have an opportunity that as ministry, as government of Uganda, we now have a national children's policy that actually brings together the different actors to talk about issues of safety and security in and around the schools. And we are implementing this together as a country. So that is also another step. Kindly move the slide. Yes. So that is the multi-sectoral approach that we are using. We have the community, we have the education sector, we have the courts of law. And when we go to the findings of this study, we are able to disseminate this at the national level to the different stakeholders. And right now, as we talk, each and every sector is actually trying to make sure that the recommendations are being taken into consideration during the planning and budgeting process. Kindly move the slide. Yes, on the issue of norms and practices, this we have many in our communities, but we've realized during this COVID period that we needed to do more. We are working more on with the community dialogues to change the norms and practices, especially around child protection. Initially, our interventions were looking at the child and then running to the teacher, but we are forgetting that the child is situated within a family, situated within a community, and within that community, this is where the norms and practices exist. So we've been able to engage in community dialogues, trying to talk about issues of safety and security. And during this period, we're also thinking that this approach can help us to remobilize children back to school after the lockdown. As you're aware, Ugandan schools are still under lockdown, but at least we do believe that when we use this approach, our children will be able to come back to school and they will be safe. Next. Okay. As far as investing resources, yes, in our ESSP, much as we've been implementing violence against children and safe schools programs in our education sector strategic plan, we didn't have an objective to talk about elimination of violence. And during the review of the education sector strategic plan in 2020, we made sure that a specific objective on elimination of violence against children is incorporated into the plan with the clear strategies and resources attached So we do believe that when it comes to investing resources, we'll be able to mobilize more. This has always been a challenge, that interventions have always been donor funded, but now that we have an objective in the plan, we'll be able to mobilize more resources. And the recommendations of the diagnostic study will actually inform the review of our national strategic plan on elimination of violence against children and the gender in education strategy. This is work that has already started, but the reports are already pointing to the fact that the recommendations have to be taken on as a country. So that is a step that we've taken, and we wouldn't have been in position to do this if we didn't have this study recommendations. And lastly, on the issue of data, I think as a country, we still have a challenge. We have not yet had a specific indicator into the EMIS, or specifically on VAC, violence against children. But we are glad to share that our EMIS is under review, and we hope to include one indicator or two so that at least it can be monitored on an annual basis. So that is also progress as far as data is concerned. Kindly move the slide. Yes, this is what I've been talking about. The issue of data, we have already made our proposals to the planning department to ensure that within the EMIS we can have data on VAC included. Next, please. We have opportunities as a country in 2020 under the leadership of the Ministry of Gender, Labour and Social Development. We have now a national child policy, and this child policy provides an opportunity for the key players, that is the ministries that are directly involved in issues of protection of children, to work together. So we have structures at the national level, we have structures at the sub-district level, and we also have structures at the sub-county levels. And we see this as an opportunity that will help us to work together in strengthening the multi-sectoral approach. As a country, how we are now implementing our national development plan, and the sectors that are directly responsible for issues of child protection, that is the Ministry of Gender and Ministry of Education, as well as the Ministry of Health, are falling under two programs, that is the Human Capital Development Program, as well as the Community Mobilization and Mindset Program. So this will help us also to address issues of norms, ensuring that children are safe in the communities, ensuring that we can work together and plan together to make sure that we mobilize resources, but also ensuring that our children remain safe in and around the school. As a ministry, we are finalizing our national school health policy, and we see this as an opportunity for us to ensure to talk about issues of safety and security of children, but as this will also help us to strengthen our efforts as we reopen schools. The Ministry of Education and Ministry of Health, Ministry of Education and UNICEF have also developed a life skills toolkit. We hope to use this to build us they are safe within our schools, but also in the community. And ensuring that our teachers have the capacity to address issues of safety and security, but also using gender responsive methodologies for all teacher training institutions on gender and school-related gender-based violence. We do believe that once this course is rolled out, it will be an opportunity that our teachers, before they are churned out of the institutions, they have knowledge to prevent violence from happening. So ladies and gentlemen, briefly, that is what we have from Uganda, but we hope to learn more from other countries that undertook this study so that we can also up our game as far as protection of children in our school settings. Over to you, moderator. Thank you.
Thank you so much, Ms. Nanyanzi. It was an excellent, fantastic presentation, really showcasing the leadership of Uganda in terms of, really ticking the box in terms of the main benchmarks toward the call to action for Safe to Learn and really the best practices that we are advocating for globally. I would just like, to highlight one of the few elements that you mentioned, including the education sector strategic plan, which I think is exactly, the kind of best practices that we want to disseminate. We want other countries to get inspired by your example in Uganda to really mainstream a violence prevention lens within the education sector plans so that more funding is available and more partners, are ready to help support you in implementing safe learning environment for all. So again, warm thank you for these very rich presentations. And because of time, I will just move directly to our third speaker from South Sudan. So last, but of course not least, Ms. Esther Akumu, who is the Director General of the Gender Equity and Inclusion Education Unit at the Ministry of General Education and Instruction in South Sudan, has kindly agreed to share her insights on the implementation of the Safe to Learn diagnostic in our country. Over to you. Ms. Akumu.
Thank you very much for this opportunity, and I'm delighted that we are part of this important session. So South Sudan actually had the study done in 2019 as well, and the final result was out in May, where we had the roundtable discussion, and we agreed and endorsed this document. The government is actually very optimistic about this because when we talk of what difference did it make that South Sudan undertook the Safe to Learn diagnostic, we'll find that this has supported us in one, next please. Yes, the diagnostic research verified the existence and the lack of policies and systems that protect learners against violence in South Sudan. So this was very important. That made us find this gap. And the assessment to enable South Sudan as a nation to identify existing gaps and possibly mobilize resources that would enable the implementation of the various recommendations, because of course, the diagnostic came out with recommendations that we are looking at now to enable us to have a safe to learn school. It led to the establishment of a baseline on ending violence in schools for South Sudan. Actually, this is out of this, that's why we had a baseline, which was through this study. And now this is what we are leaning on and trying to ensure that we progress. The assessment also highlighted gaps, which if well addressed, can provide positive change towards establishment of school safety in the Republic of South Sudan. The report provided very clear recommendations and strategies to implement towards realizing the school safety. So this is what we are following, and hopefully we'll reach where we are supposed to reach. Okay. So the next question was, what are the next steps to ensure schools are safer for all children in South Sudan? The next step is train teachers and school managers on safe schools. Training of the PTAs, Parents and Teachers Association, is very crucial, and the school management committees, that's the SMCs, and then developing the enforcing and implementation of school safety policies within South Sudan to protect learners and teachers. They mobilize and invest more resources, financial and human, to support the advocacy and services delivery in prevention of violence in school and around schools. Advocacy and awareness in support of safety in school, enact bylaws to support ending violence in schools, introducing and observing safety protocols within schools and protect learners and teachers. Engage adolescent and young people, parents and teachers, and community members in and around the schools discussion and on topics related to ending the violence in schools. And in fact, with this, on the 25th of October this year, we have been able to launch the Safe School Declaration Guidelines, which is a big achievement for the ministry, because some of the schools in the country were still under occupation by the armed forces, and this could not make learning to take place. But now with this document and approval by the Minister of Defense, has made it easy for us now to evacuate the armed forces from the schools. And some orders were given that no one should occupy the schools. So this is one of the steps that we have taken. And we are actually planning in our next sector plan, because our sector plan is ending this next year. So in our next sector plan, this will be one of the topics to be covered. And we must make sure that it is implemented. So we are saying that the partners or donors and the government have to put more funding on the implementation of the safe to learn, in order to have more children attracted to come and remain in school. And we are also trying to ensure that we revise our teachers' code of conduct, because in that the previous one did not contain most of the things, most of the occurrence that are like beating the children, trying to engage children in abusive manner. This we need to include in the teacher's code of conduct. So we are very happy of this policy, this study, which have guided us and will help us to move ahead and ensure that our schools in South Sudan are actually protected. And for sure, as Uganda have put it, this will be one of our, when we are developing the next EMIS, because now actually we have included some of the indicators for the safe to learn in the EMIS data collection, because at this time we are still collecting. So this is one of the recommendations that we got and the implementations that we have started after the study. Thank you very much for giving us this opportunity, and we thank the people who initiated this, because they have put us on the right track. Thank you.
Fantastic, Ms. Akumu. Big and warm thank you from us all for sharing the experience of South Sudan. There are so many rich lessons from your interventions, including the big focus on whole schools, the whole school approach by engaging the different stakeholders within the school community, which is, of course, a best practice that we all, as Safe to Learn partners, encourage country to do. So it's fantastic that you're doing that in South Sudan. And also, highlighting the continuum and the interconnection between the Safe School Declaration and the Safe to Learn call to action, which actually go hand in hand, because it's a continuum of violence. We have the daily violence, we have the school under attack, and all that are very much relevant. And so we are working hand in hand with all partners in education emergencies as well. Thank you for raising that. The last call on the donors and the partners for more resources. I think we are all together, and it's what we all want, because ultimately we want, safe learning to go to scale, to really be embedded within education system. And the fact that, you are planning to include safe learning and violence prevention within the next education sector plan is actually, as has been done in Uganda, and the experience in Jordan also showing the big leadership to go to scale. These experiences show us the way forward, and hopefully will inspire other countries to do the same. So a big warm thank you to the three of you for these very excellent presentations with all the rich content and insights. We have also prepared a summary of lessons learned from these three experiences at the country level, because as I was saying, you are pioneer in the field in terms of implementing and piloting the Safe to Learn diagnostic tool. And so we have collected all the insights, from these different stakeholders in each country to share and to disseminate with others what are the pros and the cons, and the challenges in doing this kind of diagnostics. So we will share with all the participants later on. I see that our dear colleague John Monday is now connected online to the event. I don't know if, John, I don't want to put you on the spot, but I am wondering, as we still have a little bit of time, if you would like to take this opportunity to share with us all your testimony. You're muted, John. Would you like to unmute?
Yes, yes, sure.
So just if you agree with doing it now, which is a little bit a reverse order, but I think it's important to take this opportunity to do it, just to introduce you for those who might not know you yet. So you're Dr. Mwemde, the founder of, let me look at my notes. The founders of Beacon Teachers Africa, really pushing forward and really, advancing the issue of safe learning in Kenya in particular. And you have a remarkable track record and a history of achievements in Kenya and beyond at the service of others. You know firsthand what it means to experience and observe violence in and around schools in Kenya and elsewhere. And we are delighted to have you with us today as the charismatic leader that you are. So the floor is yours for a few minutes before we go to the closing. Over to you, Dr. John.
Thank you, Claire. I'll just share briefly with you experiences from Kenya schools, starting all the way from my early childhood education at the age of about 10, when my first encounter with abuse in school, when my teacher verbally insulted me, plus my mother. She put me on the spot and she said I was proud, like my mother, and that my mother had dressed me in a particular dress so that I would come and show off in school. And that experience, the emotional trauma that came with it was immense. And as a result, I actually decided at that early age to never learn from that teacher. And what followed, looking back, is something that still makes me very, very keen to ensure that children are protected. The next day, I decided I was going to write backwards. I was a bright kid, but I decided never to get anything right, anything correct. as long as it came from that teacher. And so I started to write my alphabet backwards, mixing them up just to frustrate the teacher. And when the message did not sync, the next day, the following days, I started coming late. I started coming to school late. And the teacher, surprisingly, did not seem to notice. So that was my way of punishing the teacher. She did not seem to notice. So after that, I started to make sure that I came to school when they were leaving. You know, I'd be at the gate at the point the bell was ringing for the kids to leave school. And that continued for some time. And the next thing I did was I became something like a packing girl. So I'd leave home, and in between, I never go to school. I would go to the marketplace and start loitering. But two things, looking back, they surprised me that no community member ever asked me, why are you not in school? What are you doing at the marketplace? Other kids are in school, why are you here? And yet I carried my break. I carried my snack every day from home. At the end of it all, to cut the long story short, I learned nothing from my early childhood education class. And so eventually, when my mother discovered that I hadn't been going to school, she didn't even take time to ask me why. So she beat me up. And because I had determined in my spirit never to go back to that school, she beat me up, I cried. She beat me again, I cried. The next day she beat me, I cried. But I never disclosed what was going on because I was not given the space. At the same time, my mother never followed through to find out why I was not interested in going to school anymore. And yet I was the one who had cried to be taken to school at that early age. Eventually, I never benefited from early childhood. And so the rest is history. But that also, looking back, tells me that children, however young, they have a way of, expressing vengeance. They have a way of giving you back what you give to them. But that was early childhood, and I thought that was all. Mid-primary school, on a day when the teacher sent us to fetch water, I grew up in a rural village, really rural. And when we went to fetch water from Tana River, that was the biggest river in Kenya, we were a group of kids, and it was a rainy season, so there was a lot of vegetation along that route. And as we were coming back, because I was the tiniest kid in that class, the teacher had given me a 5-liter jerrycan to carry for like 3 kilometers. So when we were coming back, I was too tired. So I started to slow down and the other kids left me. I didn't know there was a boy who was just walking behind me. So this boy tried to defile me, and we were in the same class, the age of 9 going 10. He tried to defile me. But in the course of fighting, we ended up, he was pushing me, we were fighting, I was fighting back. And I ended up with injuries. I fell off, and there was long elephant grass that cut my thighs. And I sustained deep cuts on my thighs. But here's the story. When I went back to school, I did not report to anybody. I didn't report to the teacher. When I went home, I never said that story to my mother. I never said that story. My father was always away working in the city. I never told the story to my mother. I never told to my siblings. I never told to my best friend. So it remained my secret. Why did I not say it? Because I felt if I said it, I would have to explain what had happened for me to get injured. And for us in Kenya, talk about sex, whether you're talking about sexual abuse or whatever, it is taboo. So I couldn't pronounce with my own mouth about that attempted sexual violence. So I kept quiet. Now, I couldn't go to the health facility because I feared that the local clinician would tell my mother. And if my mother was told, the worst thing that would happen to me was to have to discuss with my mother an attempted defilement. It was taboo. And so I nursed my injuries for a long time, but I had to do all the work. I had to do every work that was given to conceal what had happened. At school, I was limping. I was in so much pain, so I didn't learn for long. I didn't learn. I was in pain. Today, and we're talking about the age of about 9 going 10, up to this day, the scars are there. So that tells you how deep they were, that I grew through, and up to now, they're still as glaring as they were in that first year. Apart from that, moving to high school, the story is the same. Yes, please.
Yeah, I'm very, very so sorry to interrupt you, but I must, because because of time, and we will be cut in a few minutes. But I want to thank you very sincerely for your testimony and really showing not only the issue that violence is actually has lifelong consequences and traumas, but also your story is an inspiring story of resilience and, you know, building on this trauma to actually serve others and make sure that schools are not a place where people and where children are afraid, but are safe havens. We will keep working together, and we will, you know, showcase your story in other venues. And again, a big thank you for being here with us today. Without further ado, just because we have a few minutes left only, I want to give the closing remarks to our colleagues, Ms. Vibeke Jensen, who is the director of the Division for Education for Peace and Sustainable Development at UNESCO, one of the key partners from the Safe to Learn Global Initiative, and a key partners also in the development of the Safe to Learn diagnostic tool that we talked about today. Over to you, Vibeke. Thank you for being with us today.
Thank you. Thank you so much, Chloe, and thank you to all the presenters and the last very powerful testimony, very, very touching. And good afternoon and good morning, good evening to everyone. And thank you so much for this invitation to make a few closing remarks, Chloe. As you said, UNESCO is one of the founding partners within the Safe to Learn partnership. And as such, we're always very happy to engage in various activities and advocacy efforts and so on. Now, addressing all forms of violence in and around school is very much at the core of UNESCO's work in the education sector at the global level and at the country levels, because we have plenty of evidence of the negative consequences of school violence on the education and health and well-being of children and young people, both those who are directly targeted by violence, but also the bystanders, the perpetrators, and in fact, the entire school community. And because of all these very well-documented negative consequences, going from missing classes to school dropout to low learning achievement and impacts on mental and physical health, school violence in all its forms is really a serious infringement of children's and adolescents' right to education and to learn in safe and inclusive environments, and which is a right that all countries have committed to secure by 2030 as part of the Sustainable Development Goals. But sadly, as we know, violence in schools is not a phenomenon that just affects a few children in a few countries. Global data on the prevalence indicates that almost 1 in 3 children or students has been bullied by peers within the last months. And in some countries and regions, it comes up to 40%. So very high number. And so I think we must really use our collective expertise to highlight that ending violence in schools indeed is possible. We have heard today from Jordan, from Uganda, from South Sudan, and also here from Kenya about efforts to identify violence in schools and also to develop locally relevant but comprehensive and pertinent plans to prevent and address different types of violence. And from UNESCO's own work at the country level, we know that we have to work at multiple levels to really have an impact. From strong national policies, which of course is the critical foundation, but it also has to be backed up by practical actions at the school level. So UNESCO has supported the rollout of the Connect with Respect curricula in both Asia and Africa, which is a curricula that raises awareness of rights, promotes healthy relationships, and also looks at gender inequalities, which are drivers for violence. And learners do report reductions in experience of sexual harassment and are also more likely to seek help when it happens. And also, interestingly, teachers report that the training has really opened their eyes to inequalities and to violence in the classrooms, and therefore also, once it's become visible, also able to start addressing it. And just a few more examples. In Ireland and France, for instance, UNESCO's recommendation on preventing and addressing bullying have been used to design monitoring systems in response to national response to bullying. And finally, in South Africa, just to mention one case, some new research actually shine light on the way that learners with disabilities experience violence. And I can tell you that the emerging findings certainly gives reason to really ramp up our efforts. Using tools such as the benchmarking tool that Stephen presented here today, as well as some of the guidance documents that several of the members of the Safe to Learn partnership have, a really good basis for taking actions. And just to finish, I think we're meeting here in the middle of November. It is a very important month for the topic we are talking about, because it started off with the celebration, commemoration of the UNESCO International Day Against Violence and Bullying on the 4th of November. And it actually ends with the International Day Against Violence Against Women. So I think these are some very important moments of international mobilization and advocacy, and remind us to end violence in schools, and is something that we really have to work together on across many different spheres in society. So Safe to Learn offers an opportunity for us to work across all these spheres and really to build on our common strengths. And I think we have to continue to pool our resources together. And if we do that, it's also my belief that, in fact, it is possible to end violence in schools. So thank you for that. Thank you for this excellent meeting. And back to you, Chloe. Thank you.
Thank you so much, Vibeke, for all your excellent concluding remark, actually, that set the tone, for the next step. Basically, we heard that we have the tools, we have the collective will, we have examples of countries that are showing us the way. And we have these partnerships, the Safe to Learn partnership, that is ready to act and to support countries in ensuring safe learning environments for all children. So a big thank you to all of you. We will share all the documentation that we mentioned today and the recording in the next week. And we hope to see you all again very, very soon. Thank you.
Thank you. Bye.
Goodbye.
Thank you.
Bye. Thank you.
Thank you.
Thank you. Bye.
Thank you. Bye.
Thank you. Bye-bye.
Catherine.
Bye-bye.
Thank you.